Feed your mind and the rest will follow.
Free your mind.
You start with figuring out what does health look like for me, physically, mentally, emotionally, and work really hard on being good at you.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Feed your mind, feed your body, and the rest will follow. You're welcome to Soul Food on Smooth 98.1, where we love you. We love your health. We love your wellness. It's why we discuss things about your health and wellness every Saturday morning from 8 till 8:30. And we call it Soul Food again. So you're welcome if it's your first time right here on the station that loves music, loves life, loves you, loves your health and your wellness. We have a number of platforms for you to be active with us, to interact with us. For instance, we are currently streaming live on YouTube. So it means you can see my face. It means you can see the face of my guest. It means you can go back to watch the stream later on. But importantly, you can also ask your questions, drop your feedback, your comments using the live chat option. It also means you can share with your family and friends with the link youtube.com/smooth 91 FM Lagos. Simply go to YouTube and search for Smooth FM. Then we have the WhatsApp line that we are taking your messages on. You can send your messages being your questions now, because I told you earlier that this morning we're talking about frequently asked questions on oral health. So WhatsApp line is 0809 4440981. Again, 0809 4440981. And you can dial that number as well, or you can dial 014489981. Again, 014489981. So all those questions about your teeth, about your tongue, about your gum, about your breath, yeah, we will be taking that question or those questions this morning. And I do have my guest in the studio who has a lot of years of experience in dentistry and the practice, both out of here and here in Nigeria. Is a great Akokite, I believe.
Yes, I am.
And he is the clinical director at Beaconhill Smile Group. He also serves as a board member of the Beacon Smile Foundation. So he majors in a lot of things, including general and aesthetic dentistry. In other words, if you want your smile bright and beautiful, he's your go-to person. Please welcome Dr. Uku Ntekim. Good morning.
Good morning, Oluwaseun. Thanks for having me.
It's always a pleasure to have you in here in the studio. How have you been, and how many smiles have you brightened?
Quite a number. I'm very good, thank you.
All right, so we are just asking the questions this morning, and I already have some of them. If you have any, you can add them to the list. So it's not a specific order, just questions on people's minds.
Yeah.
For instance, I didn't think I would still be bringing up the question, or we'll still be having the question of, do I really need to brush my teeth twice daily? That's a question. So what do you say to that?
Yes, I would say it's important to brush twice daily, being that when you brush at night, you remove all the substrates that bacteria can possibly feed on to cause problems in the mouth and the gums. That's talking about the teeth and the gums. So when you do that, you wake up in the morning with a fresh breath, unlike when you don't brush at night and then you wake up with a foul breath. Obviously, that's reversible, so it's not that much of a problem. But the main issue is brushing at night reduces the risk of having tooth decay. So that's really important.
What if the person did not eat all day? Do they still need to brush?
That's a very good question. Yeah, because there's bacteria in the mouth, and it's just necessary to brush at night to keep your breath fresh, to keep the gums neat and tidy, so to speak. But theoretically speaking, the incidence of decay, if you didn't eat all day, it is really little or next to nothing. So you don't want to brush at night. So if you don't brush at night, having not eaten all day, there's really no risk of developing tooth decay, so to speak.
I feel we just made a case for those people who spend every day inside and they say, oh, well, since I'm not going outside, I don't need to have my bath. I don't need to brush my teeth. I feel we just made a case for them. But anyways, I
I'm
think
sure.
if you want that fresh feeling, you need to brush,
Yes,
right?
it's necessary, very necessary.
Okay, so another one which I find interesting is which is better for me to pick my teeth, toothpick or dental floss?
Very good question. For those listeners, it's really important to hear me now because I'm not an advocate of toothpick, and the reason being that toothpick, the reason why I won't advise a toothpick is because in cross section the shape is not congruent with that of the space between the teeth. So in using a toothpick, you are likely going to increase the space in between the teeth, as well as flatten that triangular piece of gum. It's called the interdental papilla. It's really, really important, as insignificant little as it looks. It's really important. So it's necessary to use a floss instead of a toothpick. So a floss will just clean in between the teeth and not widen the space, and it won't affect that triangular piece of gum. So that's why I won't advocate for a toothpick. It's better to use a dental floss, and even if you have to use the pick of a dental floss at the end of it, it's still better than using a toothpick.
Oh, wow.
Yes.
You know, sometimes I have had it before, and I don't know if I should be worried now. Times when I pick my teeth
Mm-hmm.
and it's painful, but yet sweet. It's like a sweet pain. And one occasion, I totally forgot myself that by the time I removed the peak of the dental floss, there was blood in it.
Yeah, that's because probably there was some food substances or mixed with food and bacteria in there, irritating the gum,
Okay.
and so that sweet feeling you feel when you're picking is actually like if you're let me try to try and put in perspective when you have like a sore or something you massage, you know, when I massage it can have that sweet painful feeling, so it's something
Yeah.
similar. It's just you just like massaging the gum and trying to massage out the excess fluid in the gum that's causing the swelling, so to speak. So that's what causes that sweet feeling, but it's a sign of trouble. So
Ooh.
yes, it is.
Oh, wow.
Yeah.
Okay. Well, still similar. This person said, when I eat meat or stringy foods,
Yes.
they always get stuck in between my teeth and it sometimes hurts. Is this normal? You know, those foods that
Yeah. So I'll say this right. When the teeth initially form, as we grow from, from baby to teen and become teens and all that, when we are young and the teeth initially erupt into the oral cavity, the teeth ideally are meant to be tight together in such a way that even floss cannot pass through. But
Mm.
as we, yeah, so that's that. It doesn't follow with everybody, but for the most part, right? It should be tight. But as you grow older, sometimes tooth movement, tooth loss, and so many activities in the mouth can lead to some shift, some slight movement, and then you have spaces forming between the teeth, which now necessitates flossing. And I think that's why floss was invented, so to speak. So when you have that situation, right, it's necessary to floss. And I tell my clients that flossing has become as important as toothbrushing to clean the space between the teeth, to dislodge any food particles that may lodge there, to keep the gums neat and tidy, healthy, and to clean the surfaces between the teeth. So that's why flossing is important.
Okay. Now, about that floss, I have seen someone use the thread that you use in sewing to floss before
Really?
in order to quickly invent or to
Wow.
quickly come up with something. Invent is not the word. Well, you know, there was a need for a floss. There was no floss around.
And she
So,
just used a string. Yeah, that
yeah.
works. I'm sure that works pretty well because the concept is still the same anyway. So it works, I'm sure.
Okay, because where I'm going with the question is anything that is a string that can help you clean the middle, the part of your teeth that join to each other, can that work? But it has to be clean, I guess.
Yeah, so that's a very good question. So with floss, right? Floss is actually designed. The string is designed to clean effectively because of the kind of material it's used for. So while I would not totally condemn the emergency use of like any string to clean in between, I will always advocate for a dental floss to be used.
Mm.
Yeah.
So
But
for
one reason is because the string may not is because the force needed to go in between, right? The string you use may just cut and get stuck in between your teeth. So that's why I won't really suggest that. But in an emergency, I mean, it may be necessary. So I may not totally condemn it, so to speak, but I won't recommend it as a lifestyle or as a go-to option, so to speak. Yeah.
okay, so this is a curious question now as a result of what you mentioned on the spaces between a
Yes.
person's teeth. Um, Is there anything bad about it? Because there are people who have so much spaces between their teeth, and I guess it's part of the reasons why people
Oh,
get braces.
it's necessary I clarify when you ask that. That's a very interesting question. So the space I'm talking about are micromillimeters that I can't really see with the naked eye, so to speak.
Oh, okay.
Yeah, so I'm not talking about the large spaces that are called. Those large spaces are like 2, 3, 4, 5 millimeters. Those are spaces that have to be corrected by by realignment with orthodontics as braces or the use of clear aligners, so to speak.
Why?
Because number one, so many reasons, but number one, when those spaces, the spaces in between the teeth where that occur due to the spacing, plaque can cover those spaces, and sometimes it can be difficult for the brush to engage those
Oh,
spaces
okay.
to clean, and that can lead to progressive gum disease on a very long time. I'm talking 3, 4, 5 years, and I'm talking about a case where you grow beyond middle age to old age, and then you begin to suffer the consequence of all these things.
Hmm.
Yeah, and so also we call it malocclusion in dentistry. The misalignment, so to speak, right, cannot has other effects on the function of the teeth, the joint function, and so many things. So that's why it's nice to correct these things when they occur. Very, very important.
Thank you. If you're joining us for the first time, you are listening to Soul Food on Smooth 98.1, and we're taking your questions on your oral health and dental health. All right, another question is it true that one can develop mouth odor when the tongue is not properly brushed as a baby?
Yeah, that's possible. Yes.
Oh, really?
Yeah, it's possible.
As a baby?
Yes, but you see, the odor is not, how do I describe this now? It's not that offensive, but there's an odor, right?
Hmm.
So how do I answer this accurately right now?
Because I thought that thing, whatever, as a baby, it can be washed. Okay, maybe when you're done looking for a way to answer that one, I can ask the
No, no.
second
Let
one.
me try. So basically, right? I think so. Babies need to be given water, so to speak,
Okay.
right? Because for babies, right, you don't have teeth, so nothing to gather stuff and cause them. So basically, the tongue surface. It may be possible to use a tongue cleaner gently on a baby's tongue, but very, very gently. Okay, so, but I will not worry much about mouth odor in a baby, to be honest, except there is a pathology going on beyond the mouth that is causing the odor.
Okay, so the
Yes,
second question, which follows that before we continue with that question,
yes.
is at what age should you start to brush the tongue of a baby?
I would recommend from age 6 months,
Okay.
5 to 6 months, yes, because then that's when the cognitive they are more, the cognitive functions are more pronounced in the baby. They are
Okay.
more aware, they can sit up, yeah, and then by then they're serving the two baby teeth in front, the two baby teeth at the bottom, erupting into the mouth.
So
My
whatever
personal opinion, though, yeah,
whatever smell or odor that was gathered in the mouth of a baby, it cannot persist into adulthood, right?
not necessarily,
All right.
not necessarily.
Okay. All right, then another question. This is about mouthwash and rinses. And
Okay,
I saw a video about it, was it 2 days ago? And the person saying that it's just a marketing gimmick. But this is, can mouthwash rinses replace brushing?
no, 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 absolutely not. So mouthwashes is just an adjunct to toothbrushing, and is most effective when you floss. So after flossing, right, you've removed the particles, the major chunks of particles in between the teeth. So a mouthwash generally just goes in between to take out the residual particles within beyond between the teeth and make the mouth fresher, basically. Yeah.
Okay, so
And they also some of them also contain, like the daily mouthwashes. Some of them contain um, an agent called CPC, cetyl pyridinium chloride. That also helps to aid gum health. And then you have some mouthwashes that are like medicaments that contain antibacterial properties. Those are specific for gum disease. So I won't totally say it's for a marketing gimmick. It's not. They actually have health functions, oral health functions.
okay, speaking about which, the next says, do I need to be deliberate about the kind of toothpaste I buy, or any toothpaste can work?
I will always suggest and go for a toothpaste that contains fluoride. However, and this from personal experience, there are some toothpastes that are fluoride free, but are also healthy for the mouth, mostly for the gums. So I took it upon myself to like an experiment, so to speak, over the years. So I have two. I have one that is fluoride free, and another that contains fluoride. So what I do is that in the morning I use the one that doesn't contain fluoride, and I use the one that contains fluoride, and it has worked for me over the years. So to answer that question, I could recommend that as an option, because I don't totally condemn the fluoride free toothpaste, to be honest, because they have good functions for the soft tissues, the gums, the tongue, and all the other soft tissues in the mouth.
I'll tell you one thing that I remember. So there was a time that someone I know, I'm not going to disclose the identity,
Mm-hmm.
wanted to brush her teeth, and she had some pain or the other. I'm suspecting it's a gum disease or a hole in the gum, but whatever it is,
Or it's all in the mouth.
maybe.
Yeah.
So the person said whenever she wants to brush, because the thing indicated on the toothpaste is that it can help with pain and whatever.
Okay.
So the person applies it on the gum and the teeth before brushing, leaves it on for some minutes before brushing.
Okay.
Can that really work to
So
ease pain?
yeah, that can work to ease tooth sensitivity. So we
Oh,
are talking about a desensitizing toothpaste. That actually is the mode of action for a lot of them. So you need so for some of them, you first of all brush normally, allow the foam to remain on the teeth for 3 to 5 minutes before you rinse out, or you can just spit it and that will be fine. For some of them, you need to just apply the toothpaste on the tooth surface where it's sensitive. Leave for a couple of minutes, like 2 to 3 minutes, and then brush. So it depends on what active ingredient is in the toothpaste. So that works for tooth sensitivity actually.
okay. And the other one has to do with bruxism. I believe that's the term for it.
Yes.
Grinding your teeth when you're
Yes.
nervous or you're sleeping. Should the
Yes.
person be worried?
Yes, because it will lead to tooth wear. I mean, generalized tooth on all the teeth surfaces, and that could, if it's so bad, right, it could lead to a loss of what we call vertical dimension. So because the way the teeth are weighing down, you now begin to overclose, and then you have folds forming at the creases just beside the nose. It also could lead to tension on the chewing muscles, the muscles of mastication. It could also cause degeneration of the what we call the TMJ, the temporomandibular joint, and that's the joint that connects the upper jaw to the lower jaw. So bruxism, it's a condition that one should be worried about, and it can be managed.
Okay, maybe we should stay on that for a bit.
Yes.
Because I have seen it a few times. It might not be as common, but I have seen it a few times when someone is maybe bored or they are thinking, they are grinding, and you can see it.
Yes, you can see the muscles tense. Yeah.
So, okay, you said it can be managed.
Yes, it can be managed.
How do you manage it?
So for such, the first thing we do is to attempt to discourage the habit by giving a mouth guard.
Mouth guard.
So a mouth guard helps to discourage the habit as well as protect the teeth and the joint and the muscles from overuse and stress. So that's the go-to management strategy. Once we're able to achieve that, and the bruxism maybe reduces or completely ceases, then we can now talk about a full mouth rehabilitation, whereby if the tooth wear is so severe, we reconstruct the entire mouth with the teeth with crowns.
That sounds like a lot of money.
Yeah, I've had to manage a few in my career. Yeah.
Wow. Okay. If you're listening to us, we are talking about your oral health, and you're welcome to ask your questions. In fact, we call it frequently asked questions on your oral health. WhatsApp line is 0809 444 0981. Okay, you said smooth health. Well, this is not smooth health. This is soul food. But the question is, what are the key considerations in selecting a toothpaste formula, particularly in terms of fluoride content and other ingredients for optimal dental health?
So basically, most toothpaste in the market, they contain the required percentage of fluoride in parts per million. So for me, I'll just advise you just go for any brand that suits you, so to speak. There's really no hard and fast rule to choosing a toothpaste, and I'm not going to mention any brands on air, so you can just go for anyone. Yeah. So people have different preferences. Some would say when they use this one, they don't like the taste, or it does something to their gums, and they use other one and they're fine with it. So that's basically it. So I'll also, there are some toothpaste that are in the market that I would also recommend, and I wish I could mention the name, but I can't. Some are very abrasive, some are indicated for other uses, some I won't just. So all I'll just say is look for any toothpaste that if they show the amount of toothpaste, the fluoride content, I'm sure they don't anyway. But just stick with the regular brands in the market. Let me just say that.
All
Not to get too
right.
technical.
I have used my toothbrush for long, and the bristles, I'm just trying to pull it up. The bristles are still intact. Do
Mhm.
I still need to change it?
The question is, first of all, how long? Yeah, the bristles might be intact. They may not splay like
Yeah.
that, but more often than not, they become harder. They become really hard.
Okay.
So the rhetoric is every 2 to 3 months you change, but I've had to use a toothbrush that lasted not up to a week. So obviously that wasn't a very good one. So I had to change after a week. So the telltale signs that to determine when to change your brush are one, when the bristles begin to splay, that you see them bending like a fountain, so to speak, or they become harder than usual, and that occurs usually after 2 to 3 months. So those are the best time to change your brush.
Chewing on ice is my go-to distressor. Should I be worried for my teeth?
Chewing ice or anything hard is a no-no, and the reason is because the mouth is not designed to chew hard things like bone and ice. It's a no, and I'm saying it now. It is a no for all
Bone.
listeners all over Lagos and beyond. Please, it's a no, and the reason is because it will stress out your jaw. It will lead to tooth wear, especially if it's a habit, and you don't want to suffer the signs of tooth wear, which go with pain and sensitivity, and sometimes if it's really severe, it can actually affect the your jaw joint as well, which is also known as the TMJ, the temporal mandibular joint. So it's important you desist from such, please. There are other ways you can distress. Just find other ways to distress, please. Not a train of ice.
That bone you mentioned, not everybody is going to like it. My dear friend Priska, yes, I'm mentioning your name.
Hmm.
She loves her bones. Not that she chews on it all the time, but whenever she has to eat something that has bones, she does not rush through it. So she should desist from it.
Yes, please. Just like ice, bones are not. So the argument is that when you chew the bone that you
Calcium.
get the calcium, but that's a myth in the sense that you get a good source of calcium from your regular diet that contains fish, eggs, and even some beef as well. Your regular diet contains enough calcium, so trying to get extra calcium from bone is, it's for me it's a myth. There is no real value in the sense that the damage it causes it's more than the
Thing.
value you get from chewing them.
I totally agree with you on that because it's convenient for me.
I see this every day to Oluwaseun, every single day. There's a pattern. See, because there's a pattern that the teeth present when I see it in the mouth, I ask them, why do you chew bone? And they're like, doctor, how do you know? I say, I know, I can see it. I can see your teeth. I can see the wear. There's a pattern that appears that tells me that I know that I'm chewing bone. And it's so common in this environment. So common. It's not
Well,
good. Please
it's
stop
why
it.
I don't even like a crab. It's stressful. I have to break it open before I eat it. No, I
Okay.
don't like it. You want to make a
Let
case
me
for that?
yeah, let me make a case for that now. So some parts of the crab, right, is the bone is soft, or the shell, not the bone per se. It's not that hard. So yeah, you can get away with that. It's not, you know, but not bone. I'm talking about turkey bone.
Ah,
Have you tried turkey bone?
turkey. No
I know
way.
someone that will chew turkey bone and grind it to dust and swallow. And I'm like, the toll on the teeth, it's massive, man.
Turkey, not even
Not even
chicken.
chicken, turkey. And it's going, I know, a very good friend of mine will be going on. I'm like, man, come on. I don't want to mention his name.
Let it go,
Embarrassed.
please. No, turkey,
Oh,
that
well,
thing is
it's
hard.
hard. And they go for it. I'm like,
Oh, no, no,
no, no,
not
no, no,
me.
no,
Can
no.
never be
Please.
me. Cisco Delgado, good morning to you, Chief. You said, I have noticed a lot of toothpaste in the market contains more sugar than fluoride, though there are good ones anyway. We've got sugar in toothpaste.
Yes, there's actually sugar. I think if I'm not mistaken, it presents as sorbitol. That's normal, but except what you see could be the fact that So one may want to argue that maybe there's some fake in the market. I'm not going there, but it's normal to have some a form of sugar in toothpaste. Yes, that's not bad. Not sugar that not sugar, not sucrose or fructose that is destructive that can lead to tooth decay. So it's a different kind of. Let me not use what sugar. Let me say sweetener. That's what sweetener. So it's not a sugar per se. It's a sweetener. Yeah.
And I ask this question for all the mothers who have little humans that can just get on their nerves. You tell them to open their mouth. No, I also ask this as an auntie. When you're brushing their teeth, open your mouth, spit this thing, and they refuse and they swallow it. Is there any danger?
So there may not be any apparent danger per se, but at the same time, I won't advise it because if you so it now depends on the frequency of swallowing toothpaste. It can actually lead to fluorosis.
Oh.
And fluorosis presents in different ways. Yeah, it can affect the teeth as well. But if it's a one-off that occurs, then it's fine, so to speak. But I won't encourage it. They need to be taught to spit out than to swallow.
You slap their mouth.
No, I won't do that, but I can talk to them.
Those little humans. Okay, Cisco Delgado says, yes, so I eat bones a lot, especially chicken bones and fish bones.
Fish bone, yeah, I mean.
Some fish. Have you eaten the bone of a catfish before? That thing is hard.
No, not that. So if it's catfish, that's a different kettle of fish, so to speak. But regular, if it's a regular, so the reason why I won't even chew fish bone generally because they are very spiky, very sharp, and they can injure the soft tissue in the mouth. But those bones are soft and they don't really pose any danger like that. So you can't compare fish bone to, except catfish, fish bone to like turkey bone or chicken bone. But Cisco Delgado, please take it easy on the chicken bone. Leave it for the dogs because your mouth is not designed to crush those bones. Please, thank you.
All right, so I have this one. I have heard the saying about not rinsing one's mouth after brushing. What are the potential benefits or drawbacks of not rinsing out after brushing with toothpaste? And how does this impact oral health?
So, honestly, my opinion on that has really changed. I'll just say to each his own. Once you spit out enough, right, that's fine. If you feel fine, if you're okay with the taste of the toothpaste after spitting, that's fine because the residual amount, especially at night before you go to bed, actually helps to remineralize the teeth. And rinsing as well is what I do anyway. So there's no hard and fast rule for me, to be honest.
Okay, this one. To all those who love to eat their garlic, is there anything we can do to reduce the smell of garlic?
Absolutely not. Garlic is really
it's the absolutely not, like nothing. There is nothing you can do about it.
So let me tell you a story. This occurred when I was practicing in London, and I'm saying with due respect, no offense to anybody. An Asian man walked into the clinic, and I'm online to Oluwaseun. As the man opened his mouth to speak, the clinic wasn't really a big place. It was a small practice. I was posted there just for a couple of days, so that wasn't my brand, so to speak. So it wasn't a large space. I'm online to you. As this man opened his mouth to speak, the entire clinic was filled with the smell of garlic. It was so bad that once he left, we had to spray. It was really that bad. So that's why I don't do garlic. It's healthy for the body, really good, but it causes mouth odor. I'm sorry. I'm really sorry. With all the apologies. I'm not saying you shouldn't take garlic, but you can take it in mild to moderate amounts, and it shouldn't really cost so much. Even if the smell lingers, maybe for overnight or something, it'll be good. But there are some that they go at it with reckless abandon, and man, the odor is really terrible. I'm sorry.
Okay, and that's it on garlic and mouth odor. Well, the other one is about whitening of teeth for someone who has brown teeth.
For that question, yeah. So I saw a patient 2 days ago, and I'm just telling a story, but I'm going to answer your question. He had some minor defects on his teeth, and I was really afraid that he was going to have sensitivity. So I almost discouraged him by saying, you know what, let's just give it a chance, see how it goes. And eventually he did it, and it was fine. There was no sensitivity. So to answer the question, right, teeth whitening for me is purely cosmetic. There is no clinical component to it, so it's purely a cosmetic procedure for the most part, right? There are some where the tooth discoloration is so severe that whitening may not really work, and that one may need some other intervention. So yeah, I can excuse that. But for the most part, we just want to just have a slightly whiter smile and blah blah blah, so to speak, which is fine. Now, it's not every tooth or every monster that is suitable for for whitening. The whitening is only indicated when the enamel of the tooth is healthy. If one has defective enamel, where it's thinned out due to chemical wear, or there are some genetic defects like hypoplasia, called hypoplasia, like all those whitish spots on it, then I'm not too comfortable whitening such teeth. So it all depends on how healthy a person's enamel is. That will not determine if the person can do whitening or not.
Is it true that chewing sugar-free gum after meals can help prevent cavities? I have heard it can increase saliva production, but is that effective for oral health?
In the manner of saying, it is because um, saliva production inhibits um, effect the effect of bacteria in the mouth.
Mm.
So chewing sugarless gum just makes your teeth fresher. It stimulates saliva production.
Sugarless?
Yeah, sugarless. But then again, chewing gum excessively also has its own effect. So if it's just what you chew for a couple of minutes and dispose of it, which is fine. But I don't advocate for gum to be chewed on and on and on and on repeatedly, because it has effects on the jaw joint as well.
Because back then, our parents used to tell us if you chew gum repeatedly, you will lose your teeth when you're old. Is that true?
Not necessarily, but it will definitely affect your joints. Some years ago, I had to deal with an 18-year-old young lady who was having jaw clicking just on only one side, and she had some pain. And I asked all the questions I could ask. Well, it was quite unusual at the time. And I just asked the question, "Did you gum?" And she just smiled and looked at my mother. She was 18. And the mother now went on her, "I told you, I told you, I told you." They were Indian, by the way. "I told you, don't chew gum. I told you, I told you." I said, just calm down. So that was really a turning point for me. And I never, and at the time, which was a couple of years back, I never realized that chewing of gum could affect the joint so bad until that day. So that's why I don't advocate for it as a habit.
Okay, well, every other person who has developed that habit now, I guess they have to look for a replacement or
Yes.
look
I
for
mean, you can
something.
chew gum, but not on and on and on for hours on end. You can just chew it for a couple of minutes, freshen your breath, and then go about your business, and that's fine.
Okay. Well, we are
Do you
now.
chew gum?
Once in a while.
Do you chew on and on and on?
Oh, no, no, no,
Okay,
no.
okay.
It's stressful. I consider it stressful. I'm
It
old.
is. It is.
It's stressful.
I wonder. Well, some people just do it as habit. People have different habits. So, yeah.
It's very stressful for me. No, so there's no point. Plus, sometimes the gums you have these days, I think there was one time that I chewed a gum. It got harder as I chewed it.
Yes.
I'm wondering why. Why would
Yeah.
I want to go through this
I
stress?
experienced that once, and after that, I said, no, 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 I can't do that. I can't do.
Yeah. So, no, I'm not a fan of gum. Well, we're now done. Time is up, and we need to
Wow.
wrap this up. Yep, it's 34 minutes past 8 o'clock. Thank you for your time. Thank you for joining in the conversation this morning. Some
Thank you
other
for having
day,
me. Thank you. And
we'll
thanks to the
definitely
listeners
click
as
in.
well.
Yeah, it was a lovely one. And I hope that a lot of people have gotten clarity. And even some of the questions you had on your mind has been answered, or they have been answered. Next week, we'll go again on Soul Food from 8 till 8:30 on Smooth 98.1. Are you now active on social media?
I am.
Oh, yeah. What's your handle?
Do Okay, I know on Instagram I'm Dr. _Uku. So on Facebook, Uku.Ntekim. And just those two, yeah.
At least you remembered Instagram. That is good. Dr. _Uku.
Yeah, all small case.
Okay. One
Lower case.
lower case. Okay. Yeah. All right then. Well, that's it. In case you're looking for him, find him on Instagram. Thank you, and thank you for being a part of the show. Soon enough, we'll be having the children on Curious Minds from 8:40, and as always, it will be a lovely time with them having that conversation and whatever it is that they have on their minds. You're listening to Breakfast in Bed on Smooth 98.1, and my name is Oluwaseun Olusegun.
And you're listening to Smooth 98.
Time went by really
Keep listening.
fast.
What
you.
we're
I'm
gonna
telling
do
you.
right
I was
now
having
is
fun.
take you
Yeah, I know. I was having fun too. Well, you're going back to the clinic?
I'm going back home.
Oh,
I'm not working today.
oh, that's
with
good.
I'll
Motown
let you. I
greatest
actually
hits
struggled to
from
get out
as
of bed
far
this
back
morning.
as
Oh,
the
I'm
70s.
sorry.
My
I was
Sorry.
making an okay, so today now.
Uku
Yeah,
Ntekim.
If that's the case,